When Phyllis Leppert was cast as a pregnant woman in her 1974 Duke medical class skit, she didn't need to do much research for the role. Before entering Duke, she was a nurse, then a midwife at Columbia University, and had cared for countless pregnant women and delivered enough babies to fill a school bus.
The reason I wanted to come to medical school is I wanted to learn a lot more about the care of women and babies. And
learn she did. She eventually rose to become a national leader on reproductive medicine and helped to save countless women from infertility or hysterectomy through her groundbreaking work on non-cancerous uterine fibroids.
They are very common tumors, in fact the most common tumors of women, and they cause symptoms of pain and bleeding and the leading cause of hysterectomy. But we didn't know a lot about their biology. Partly, I think, because they didn't really kill anybody. They really were a nuisance phenomenon causing pain and bleeding, and we now know infertility.
She pursued her fibroid research while holding faculty positions at various institutions, including Columbia and St. Louis University. In 1999, she was recruited to head the reproductive sciences branch of the National Institute of Child Health and Human Development at the National Institutes of Health. While there, she worked with Duke to establish the National Clinical Reproductive Endocrinology Scientist Training Program.
A bunch of us at NIH were sitting around one time talking about clinical research in reproduction. And we knew that a large percentage of patients were seen by physicians outside the academic environment. And we felt that Duke would be the logical people to be our partners in this. And that was actually why I became an adjunct professor at Duke in 2004, so that we could accomplish this partnership, so to speak, with Duke and NIH.
From her time here as a student and resident, where she became inspired by research during a year working in the lab of pediatrics Professor Stuart Hanwerger, to her time on the Duke faculty, where she helped to ramp up research efforts in the Department of Obstetrics and Gynecology, Dr. Leppert says she has always had a soft spot for Duke.
I've always felt very loyal to Duke because Duke really gave me a great chance. I had been out of school for 9 years by the time I came to medical school. I was in my 30s. It was a little bit of a risk, I think, because, you know, it's hard to go back to school.
Though retired, Dr. Leppert continues to be an active advocate for women's health issues. She and her brother, a geneticist at the University of Utah, have formed the Phyllis and Mark Leppert Foundation to raise money for reproductive sciences research through their Campion Fund.
Well, our dream is to make it as big as the March of Dimes. We've given 2 awards through the Triangle Consortium of Reproductive Biology, which is an organization that's been around for about 23 years in the Triangle area, and it's now including all of the universities in North Carolina.
To relax, Dr. Leppert enjoys flower gardening and Scottish country dancing, which involves 8 different couples, similar to square dancing.
The music is really great. I mean, you can't not dance to this music.